I would like to ask, what effects do you think sciatica has on pelvic pain? I had a back surgery at the end of December of 2022, and previous episodes of back pain and sciatica were relieved by medication. The surgery significantly reduced the sciatica symptoms, but pelvic pain symptoms persisted. The whole problem started 15 years ago after a bicycle accident, after which I was not immediately diagnosed with disc herniation and only my pain from the accident was being addressed. Additional factors to my pain may include a very sedentary type of work and weakening of the core muscles. In retrospect, sciatica wreaked havoc on my entire nervous system. Pressure on the spinal cord, cauda equina, and the sciatic nerve itself was significant, and the herniation was at L4, L5 level. Currently, I'm under the care of osteopath and urogynecological physical therapist. The main symptom I'm struggling with is constriction and pressure of the muscles around the anus, vagina, and the urethra, which is most likely caused by nerve damage in that region. The pain in these areas appears to intensify during and after menstruation and is most severe around the anus. The urethra was initially also very tight. However, with the help of a physical therapist, it got better. I found out with the help of physical therapists that I have significant spasm of the pelvic floor muscles and my pudendal nerve may be affected. And this is after many visits to neurosurgeons and gynecologists who did not give me that diagnosis. My physical therapist initially was focused on strengthening the muscles of the entire body, but I asked for the pelvic exam, and after palpation of pelvic floor muscles and the area of the pudendal nerve, she significantly relieved my pain. Additionally, my osteopath, instead of massaging the points on my back, also treated my abdomen and groin. This significantly improved the comfort, among others, bowel movements and pain after bowel movements. Unfortunately, my symptoms are slowly coming back, and I am planning another session of relaxation with physical therapy. So the good news is that you probably do not have a compression of the pudendal nerve. If you had a true compression of the pudendal nerve or true entrapment of the pudendal nerve, then physical therapy would not have helped you. So you have a condition that I call a pseudo-entrapment of the nerve. So the pseudo-entrapment of the nerve is when the nerve is entrapped by the spasming muscles of the pelvis. And there are several areas where that spasming may occur. First is the piriformis muscle and the sciatic nerve, and then right here is the pudendal nerve. So when there is a spasming of those muscles will be putting the pressure on the nerves. And this is why the physical therapy relieved that pressure. The second is the area in the center of the sit bone, and this is the pudendal nerve running through the obturator internus muscle, which happens to be the same muscle as the muscle inside the pelvis. So this is the obturator internus muscle, and here you see the obturator internus muscle also. And the pudendal nerve runs through the tunnel in that muscle, which is called the Alcock's canal. And when that muscle is spasming, it is going to put the pressure on the nerve. So normally there's a lot of room in the Alcock's canal, and the nerve is free and not compressed. When the obturator internus muscle tightens, it is going to put the pressure on the pudendal nerve. And the third area is the area where the pudendal nerve leaves the Alcock's canal, and there is a branch that runs to the clitoris and the branch that runs to the labia. And also, actually, in the Alcock's canal, there is a branch that runs to the rectum or anus. So this is the reason why you have the pain. It's tightening of the muscles, and we know that because relaxing the muscles will help with pain. And why did it happen in the first place? Well, there are many muscles in the back that connect to the muscles in the pelvis. So with a back injury, there's frequently an injury to the pelvic muscles. And even though decompressing your sciatic nerve helped with the sciatica symptom, the muscles in the pelvis remained tight. The good news is that it may be treated. It may be treated with appropriate physical therapy. You are already doing that. I would recommend using muscle relaxants, except the vaginal muscle relaxants with diazepam, baclofen, and sometimes ketamine are more helpful. And as I mentioned in numerous videos in the past, injecting botulinum toxin into those muscles may be very helpful.